Today we're highlighting the extraordinary care provided to the tiniest heart patients. St. Joseph's Children's Hospital in Tampa has earned national recognition for that commitment to exceptional care for these patients. The hospital was named a Level 1 Children's Surgery Center by the American College of Surgeons, the highest designation on a pediatric hospital can receive. Today we are joined by Dr. Patel, a congenital interventional cardiologist at St. Joseph's Children's Hospital, to talk with us about congenital heart disease, the most common birth defect in the U.S. and a groundbreaking, minimally invasive procedure that's improving outcomes for fragile newborns in the Neonatal Intensive Care Unit, or NICU. Dr. Patel, I am so glad you were able to make the time and come here today. How are you?
I'm well. Thank you for having me.
Let's just dive right in. For families who may not be familiar, how common is this for newborns and infants?
Congenital heart defects are one of the most common congenital defects that we see, and almost 1% of all babies who are born can be born with congenital heart disease.
Well, what is this, a condition you treat in premature babies called PDA? What is it? Most importantly, why is it so dangerous, and we need to take note of it?
Yeah, PDA stands for patent ductus arteriosus, and it's a connection between the aorta and the lung arteries. That's normal in the womb, but usually closes in the first week of life. It's a connection that tends to stay open for premature babies, and when the connection is open, it can allow for extra blood to flood the lungs, and it makes it very challenging for these small and fragile babies to breathe, and they get stuck on the ventilator. And being stuck on the ventilator can cause chronic lung disease and high lung artery pressures that can be a risk factor for mortality in these babies.
Well, I want to circle back to get to this game-changing procedure that I touched on in my introduction to you. Why is this so important? And of course, being able to offer minimally invasive, I can only imagine the fact that it is a game changer with our littlest of patients.
Yeah, this procedure can be done safely with relatively low risk to get rid of the PDA and help these patients progress. The way that we do the procedure is with a tiny little poke in the vein by the groin. That poke is about the size of the tip of a pen, and that poke allows us to navigate through the heart to the PDA and deliver a device or a plug to keep that PDA closed for the rest of the patient's life. And we see these patients have immediate improvement in their symptoms, and they're able to get off the ventilator and get the breathing tube out much faster and start their journey on getting home from the NICU faster.
That's just incredible. I mean, just to think a little poke like that can be able to do such incredible work. I also want to talk about this program that is being built at St. Joseph's, the Preemie PDA program and referral network. Why is this so groundbreaking? And more importantly, how is this really helping preemies and their families?
So, we're fortunate here at St. Joseph's Children's Hospital and St. Joseph's Women's Hospital that we have this service available to our babies who are in the NICU, stuck with big PDAs. But there are a lot of delivery hospitals and NICUs in the area who don't have this same ability to provide care that patients need. So the goal of this program is to reach out to all the delivery hospitals in the area and say, hey, we have an easy way for you to transfer these babies to us so that we can get them the care that they need, but then also get them back relatively quickly so that they can be closer to the NICUs that are closer to the families' homes so the parents can still be present. So it's just about getting patients in our community access to the care that they need.
It's so positive to hear about hospitals working together for the greater cause of the patient. I love this program. I love learning about what you are able to do and how technology is just continuing to save lives. Dr. Patel, thank you so much for your time today. If you want more information about the pediatric cardiology services at St. Joseph's Children's Hospital, you can even scan that QR code right there on your screen.